Thanks for joining us for the Hutchison's Huddle today. Um, uh, in recognition of National Infertility Awareness Week, and also keep in mind today is Earth Day. So you probably are all noticing that we have less air pollution, which is awesome. Um, so anyway, this is a really interesting huddle today because we've got three different couples who all have different experiences, different journeys. And I just think that's fantastic because there's so many different, there are so many different kinds of patients for fertility patients. And I think that, hearing their different journeys is really important. So I will introduce them. I'm just going to say their first names. And then they can tell you their histories as they feel comfortable with it. Infertility is a very personal journey, and I remember going through it a long time ago and feeling pretty embarrassed about it, and just really not wanting to talk to people about it. Not until significantly later, anyway, was I kind of comfortable with that. So I think that for I'll let them kind of tell you their stories as they see fit. And then if people want to ask me questions or something, I'm happy to field those, but I won't tell you any personal stuff about these couples that they don't tell you themselves. But anyway, you can see this is my sister Holly, and she's our IVF coordinator. And anyway, so this is my first time doing one of these sessions with different people. So what we'll do, I'm going to kind of introduce you. So our first couple I'm going to introduce you to are Brandon and Kinley. And I got them. Hey.
Hello.
Hey, Scott. How are you?
Good. How are you, Brandon?
Doing well. Doing well.
Very good. Well, do you have any thoughts on all of this process or recollections for, at the beginning of your fertility journey?
For me or for Kinley? Because I think our recollection is a little bit different.
Yeah.
I'll let Kinley go first.
Okay. So we tried on our own for about 3 years. I knew I had endometriosis from past pain growing up. So after a year trying, we went to Dr. Hutchison and got tested. Brandon found he had slow motility and I had the endometriosis. So we ended up doing IUI 2 times. We're not successful, and then did IVF. And on our first transfer, we were blessed to have our little boy Jackson. And then we had 2 other embryos. Unfortunately, the second one didn't take, and the third we miscarried. But we feel very blessed in that because we had Jackson. It kind of gave us kind of a false hope the first time because it was so easy for us, but we realized we went through the 3 years of struggle, and this IVF process still has its own struggles in itself. So you have to maintain kind of that realization that nothing is promised, and it's a journey. But after that, we were actually scheduled for our second IVF, but COVID-19 kind of hindered that. And then my endometriosis has been pretty bad the last year after I had my baby. So about 48 hours ago, I actually was in surgery and had a lot of adhesions and scar tissue removed on Tuesday. But it's just a different process with IVF. And the biggest thing that we probably said in our quote is that it'll be your hardest journey, but the reward is so much bigger than that. So even though we've gone through 3 years of trying or IVF or IUI or multiple surgeries, the best thing is Jackson, who's over there eating his dinner and watching Moana. But IVF is not a promised thing. You have to be strong as a couple as well as a family. And I think that we've been able to do that. So Dr. Hutchison has been wonderful in the whole process, as well as Holly, and we really appreciate it.
Oh, thanks. So, well, that's great. So let me introduce the next couple here, and they are Grace and Caitlin. And And there. Hey, how are you two? 3. Good.
She's watching the Clubhouse right now.
Yeah. So, do you want to tell us a little bit about your journey with this stuff?
Yeah, so obviously our journey was a little bit different than other people's. We're infertile for other reasons.
Yeah.
So for us, when we first met with Dr. H here, he just really explained everything to us because we came in not necessarily clueless, but we weren't sure what we were getting ourselves into. And we didn't know the process. We didn't understand any of the terminology. So that first consultation was full of a lot of questions. And I really appreciate you, Dr. H, for taking the time and really putting us at ease and answering all of the questions that we had in regards to this process. Luckily, we didn't have anything underlying that caused that would cause further infertility for us. So we proceeded with IUI, and on our second try, that worked for us. Thankfully, we got blessed with this little miracle here. And now we're actually trying to have our second one. We went through 2 unsuccessful cycles of IUI before the virus hit us, and then we had to pause our 3rd cycle. So now we're just in the waiting game until we can start that back up.
Yeah, that's it. You know, and it's an interesting thing, and it's kind of unfair because there are other couples who need to use donor sperm as well, you know, we're not supposed to do fertility treatment, but like I've heard over and over again from both straight couples and gay couples who need to have donor sperm that, you know, hey, these other people have sperm, can go ahead and try. Why can't we? You know, it's not really fair. Yeah, it's interesting. So what we're trying to do, we've got we're going to be doing diminished ovarian reserve cycles for creating embryos, at least anyway, in May. And we feel like with our anesthesia team that we've worked out a way that will be the lowest risk for us being vectors of virus or patients being vectors of virus to each other. But, you know, I'm still waiting on the ASRM. I checked it this afternoon. It's the asrm.org. And you can go to I would just go to the professional side of it, the right-hand side that's red. And pretty close to the top of the page is the COVID-19 recommendations, and we'll see when they kind of change that over time.
We've definitely been checking there, seeing what's going on, seeing when we might be able to get started again.
Yeah, you're here. Well, cool. Let me bring on our 3rd couple. So this is Steph and Sterling Patterson, or Steph and Sterling. Okay. Hi. Nice to meet you. So do you want to tell us a little bit about your journey?
Steph, your microphone's muted.
Oh yeah, your microphone is muted.
Can you hear us now?
There you go. Yep. Yeah.
We started trying over 2 years ago. We first went to our OB after a year, and they had us do just the basic HSG testing and put us on Clomid. After that looked good. We did 2 rounds of Clomid. At this point, we were like 16 months into trying, and we got pregnant, and we were so excited. And we waited till that 8-week appointment, and unfortunately, they couldn't find a baby, and they thought it might be ectopic. And 2 days later, I was in surgery removing my right fallopian tube, and unfortunately, ending the pregnancy. So we tried after that with letrozole for a few cycles and Clomid, and we haven't had any luck. And I continually ovulate on the side that I lost my tube. So we had one of Dr. Hutchison's patients who lives in the state we live in, which is not the same state Dr. Hutchison is in. And she said that he was awesome, and she referred him to us. So then I had a consult with him, and we were supposed to start IVF, but the COVID thing happened, so we weren't able to proceed.
Yeah, well, we'll get there.
Yeah.
And certainly, you know, I think that we'll see how this group in May does, and see how doing the slower pace and the more time between cases works out for doing IVF, and then hopefully even some of these Clomid and letrozole cycles we can start back up to. But it would be nice to be able to create the embryos when everybody's a little bit younger rather than being a lot older. But the fortunate thing is for all of you, you're all youthful, which is good. We have some more time. Holly, what's your 2 cents worth on what have you learned over now? Gosh, we're into it for what, 26, 27 years or something like that.
Yeah, I mean, it's hard, you know, and it's National Infertility Awareness Week, and everybody's just been on pins and needles thinking, like, what are we going to be able to do, and when are we going to be able to do it? It's super stressful. It's already stressful enough to be infertile and have to go to a fertility specialist to get pregnant. And then this stuff happens, and it's just, and everybody, you know, everybody just gets thrown for a loop. But I think one of the things we've all learned in the years that we've done this is that persistence pays off, and you can never predict completely what your outcomes are going to be all the time. So you have to, it's kind of like with COVID, the same thing. If you don't have any tolerance for ambiguity of what you don't know can happen, then it's going to be a really hard journey for you, because just like anything, something else comes in. I mean, Kinley's been through surgery already again, and you didn't probably expect that either. So there's always these unknowns, and we just have to kind of steal our reserve and fight through them. And I think the people who are persistent, they're successful. They end up having the family. So. Yeah.
And then, you know, trying to keep a good attitude too, I think is really important. So you know, for these 3 couples, I think they're all really very well-grounded individuals. But you know, there's a lot of people who have pre-existing anxiety and depression. And this whole COVID thing and having to put things on hold just makes it a ton worse. So I would encourage anybody to get therapy, and the cool thing is all that is being done over the telephone now. So it's or through televisits, and it's really helping, I think, a whole lot of people. So I would encourage you to do that, and then trying to keep in good health, you know, in this slack time, because the worst thing that I think that we could do is to kind of backtrack and, like, you know, start smoking pot again, or start drinking, or eating flaming hot Cheetos and ice cream and stuff like that, and not exercising or getting your sleep hygiene messed up, you know, so that while we're in this holding pattern, that we can keep our eggs and sperm as good as we can get them, so that when we're ready to try to get pregnant, we can do it. Do any of you have thoughts on that? I know that's difficult, though. Anybody?
I have a question for him. What would your advice be to someone who knows they're going to need to start through fertility treatment? What would be your advice to them, especially now, because things are kind of on hold? Knowing what you know now, what would you tell somebody who's new to the journey?
I would say for Kinley and I, it's just, you have to be willing to be a team. Like, you have to be a strong team and not pay attention to everything else that's going on around you. I think one of the things that we struggled with the most was that everyone else around us was getting pregnant, but we couldn't. So I would say, don't worry about what else is, the stuff that's going on around you, but just worry about the 2 of you, and just be a team and focus on each other, and you'll make it work. It'll work in the end.
Yeah. The good stress outlet was we would walk around Huddle, which is a park here in our town, and we just would walk and talk about our frustrations, and that would help our fertility. Because, I mean, we were married 4 or 5 years, and then we'd go to weddings, and they'd be married a year and end up having a baby. So it was really hard. So just being that teammate, because they understand what you're going through, and taking long walks and just telling what your frustration is and getting through it, which also helps infertility in the sense that you're exercising. That really helps us.
Yeah. That's
Good
great.
idea. Yeah, great idea. Yeah, I had a patient. It's funny how like you notice when other people are getting pregnant all around you, and I think it's worse. It's worse than it was for us because of the social media part of it. Because curate their lives on the social media and they only show you what they want you to see, and they're not usually telling you about the not getting pregnant and the miscarriages or the ectopics or whatever. They're showing you their pregnant belly or whatever. And I had a patient in here a couple of days ago, and she started to cry, and I said, well, what's going on? And she said, well, so this friend of mine got pregnant really easily, and she told me about it today. And I said to her, oh, I'm so happy for you. And she said, and I'm so angry with myself because I'm really angry at her and I feel really guilty about it. Yeah, so it's an interesting process. I can remember that with my spouse coming home and crying a lot, but anyway.
I think,
go ahead.
I think for me, we started sharing about our journey right after my ectopic pregnancy. And it was healing for me to have so many people reach out and say, I have had one also, or I know someone who's had one, or just even have like family and friends support. I think we don't realize, just like what you said, how many people are actually going through the same thing as us. And because it's not something that's so maybe socially acceptable to share on social media, it just kind of seems like it's not apparent and it's not happening when it is. There's a lot more people in our lives going through the same thing as us.
Yeah. And ectopics are so scary because, that's still the #1 killer of pregnant women in the United States. And and just how it just spins your head because you're thinking you're going to have a baby. And then they're telling you got a life-threatening problem and you need to have surgery for it. I just think that's a horrible, horrible thing to have to go through.
I nearly died from it.
Yeah.
Hospital 8 days. They wouldn't transfuse my blood because it was during another big virus that we didn't know anything about called HIV. I'm really old, but yeah,
those are the days, man.
It's a personal spot for me when people have gone through an ectopic because it just sucks so badly.
Yeah, I remember that. You didn't give, and you couldn't do. They found out there had been a paper that your family members, like for a while, they thought, well, what if we just have our family members donate our blood for us? Then we'll know that it's not infected with HIV. Well, then it turned out that because people, will not share everything about their personal lives with their family members necessarily, it turned out you were more likely to get HIV from a family member's blood than donated blood that was anonymous. So, so those were the days where, man, we were not transfusing unless you were like gonna die.
Yeah, that's hard.
Bummer deal.
Yeah.
But anyway, does anybody else have any input or thoughts or questions or suggestions?
I think right now it's really important to just stay like as mentally resilient as you can, because everybody keeps making jokes every time I get on social media that there is going to be a quarantine baby boom. So I think it's really difficult reading those things when you're starting with like, we can't produce a baby naturally, So that's all we want. It's very, very difficult to see other people get pregnant so easily without even trying. Literally 5 people at work today, or this past week rather, told me that they were expecting. So it's very frustrating when you've tried and tried and tried, or your plans have been put on hold because of something like this. And it's just important to stay as positive as you can and really focus on the bright side of things, because the virus will end eventually and we will get what we want.
Yeah.
I think patience is the biggest thing for sure. Just trying to be as patient as you can with it and just kind of trusting the process and kind of just trusting that what's meant to be will be kind of thing. So, I mean, that's what we've been telling ourselves. We tried twice before this thing hit and we were unsuccessful with getting pregnant. So we just keep telling ourselves, what's meant to be will be. And when it happens for us. So it's just keep that positivity and your faith within your relationship and stuff, and just kind of trust the process as much as you can.
Yeah. I have a question for those of you who've been through this stuff. How could we do it better? What could we do that would have made it easier or better?
Scott, I'll jump in. I don't think that, I mean, for you and Holly and the rest of your staff, I don't think that there's anything that you guys could have done better. I think that there was a lot of sympathy, there was a lot of empathy, there was a lot of explanation and clarity from you guys. I think that Kinley and I had a lot of questions, and I think that for me as a man, it was demoralizing not being able to provide for my wife, but you guys just solidified that that's not the case. I think that for Kinley, it was not being able to provide a child for her family. And I think that you guys were fantastic in the entire process, and you gave us comfort, you gave us reassurance. So
you were patient.
Yeah, you were very patient with our 1,000 questions, but as far as anything you guys could have done better, I would say zero. There's nothing you guys could have done better.
I think you do a great job reaching out even after things are successful, or if they're not, just to make sure we're okay mentally, physically. And it just has been a big appreciation. So we think of you guys as family after, you know, giving us our miracle, but having a tough time too. You were there in that support too.
Even when Jackson is up at 1 a.m., we still thank you guys.
Yeah, you haven't tried to give him back to me yet.
Yeah. Time's coming.
Yeah, it's you know, remember somebody saying that, like, doing childcare, it's like against the Geneva Convention. Like, you can't do to prisoners what babies do to you. You know, it's
true.
All this sleep deprivation, all that garbage. So
it's true.
Yeah, but if anybody has, or anybody who's watching, if you have other suggestions, even like how we manage phones, how we, it's going to be different with the COVID thing, because it's one person in, one person out of the office at a time. Sorry, there's a little cat here. And so it's this weird thing where, you know, we have to have people put on a mask, sanitize, and it's one person in, one person out. And so I guess the normal office flow is going to be a little bit different. But if you have other suggestions, like I had a patient the other day who was like, you know, I'm glad that you're not shaking hands anymore, because I always thought it was really creepy that doctors would shake your hand in the exam room. And so I'm like, well, okay, that's, you know, it was nice to kind of know that was sort of the case. But so let us know if there's something that we could do better.
I really kind of just want to give you guys a shout out, because I feel like you made this whole journey so much easier than it could have been. And the fact that every time we walked in there, all of your staff, especially you, sir, you really made us feel like you cared about our journey just as much as we did. So I just want to thank you guys for that.
I had a lot of insecurities going into that office, because if you've ever had to deal with the process of picking a donor, it's very stressful. You're given limited information, and you just kind of have to trust that hopefully, especially me, I'm not biologically connected to my daughter, even though we look identical practically. We're not biologically connected at all. I was terrified, like actually terrified, that this baby was going to come into the world and I would have no connection to her whatsoever. Like that bond just wasn't going to happen. And I mean, all of those fears washed away the moment I held her in my arms. But I had a lot of insecurities going into your office. And after having that first meeting with you, I didn't have them anymore. And that's why when we talked about having a second one, I was like, well, we need to do it before we leave Tucson, because I'm not going to another doctor. So either we're doing it before we leave, or we're coming back to go to Dr. H, because I'm not going to another doctor.
Oh, that's something. All right.
I think one of the things in this COVID thing, I was thinking of things we can do better. I had a patient tell me the other day that it's because people are not in the office together, there's been some disjointed things, particularly with billing and with understanding what the billing cycle is, because we've got billing is not in the office right now. And so I think it's going to be one of the things we'll hopefully get worked out, so that we're cohesive in terms of how, you know, we still present as an office staff that talks to each other. So it's been
right.
Kind of,
that is
from home is a little different. So
that it is a little wonky, but I'm kind of liking doing the televisits. Karina and I were talking earlier about that I really feel like it's the televisits for the patients. First of all, like we have more time now, so we can go over stuff. So the average televisit is like an hour, and we go through all of the supplement stuff and the clean living and all that stuff, and we're able to get all that done. And then not having, the weird thing is, like whenever people are doing physical exams on you, it's super to me, that's very stressful. It's invasive, it's stressful, and to be able to do the exam at a separate time for, because that's what we've been doing. We'll bring people in at a different time to do the exam, and it just seems to be a lot less stressful for people. So yeah, so I think it's actually working out pretty well. But yeah, have some patience if there's some incommunication or miscommunication going on, or call me and let me know.
I have another question for you guys.
Oh, go ahead.
How hard was it to make that first call to a fertility specialist? Like for somebody who's, again, just going through this process, how hard was it to make that call? And then how was it once you've made the call?
She made the call, wasn't me. She's the one that found Dr. H and then was like, hey, I made an appointment with him. This is the day we're going in. And I was like, all right, cool. Like I don't know.
I gave her no choice.
Yeah, I didn't even know who he was until I walked through the door and met him. But I was terrified again with the whole process of my own insecurities with having a donor and stuff. I was terrified walking in, and after she told me she had made the appointment. But after, it was kind of like a relief because all of the questions I had, they were all answered thoroughly, and I could ask as many questions as I wanted to, and I didn't feel like I was asking too much of him at all. So, I mean, I left with a lot of relief, and then I was excited, like, okay, yeah, we can do this. I'm excited now. I don't have this fear kind of hanging over me.
So, and for me, I already felt confident walking in because I was referred to you by a former patient of yours who spoke your praises. So I already felt confident in your abilities before I even walked through the door. And that was only reinforced after meeting you and going through the process.
Oh, that's nice. Thank you.
I felt really confident because I also had a patient refer us there. Not only had we heard amazing things about Dr. Hutchison, but everybody talks about Holly. Like, oh, she's awesome. She's so organized. And so I felt really confident. Yeah. But the whole thing is really scary. I mean, after we got our prescriptions and everything, it's really scary going through this. Like, I think 1 minute I'm super excited and I can't wait and I wish I could start tomorrow. And the next time I'm like, give me like 6 months, It's just hard to swallow that this is something you have to go through. So I don't know if I'll ever feel like 100% ready. I think I'll always be kind of anxious about the situation, but I'm really confident in the team I have. And I think that's the best thing I can go for.
Yeah. First cycle of treatment with anything, even if it's just like doing insemination, I think it's pretty anxiety provoking because you have no idea what's going on. But we give people like these stats, like, 10% for IUI or, 40 to 60 with IVF or whatever, but you don't really know what that means until you've kind of gone through it.
Yeah.
And it's a weird thing. And I don't know, you want it to work so bad that you want it to be 100%. So anyway, but anyhow, well, any other, one of our patients is saying, we waited so long to make a call to a reproductive endocrinologist. I was worried how the process would go. And that is such a common complaint or common worry that people have because they just don't know kind of where they go. Yeah, and another person is saying, it feels like a taboo subject, but it is interesting. Like you were saying, Steph, that once you bring it up, then people are like, oh yeah, well, we did that, or oh yeah, I know, my sister had to go through all that and stuff like that. Then another patient of ours who's pregnant right now is saying, my advice for starting treatment would be to eat healthy and exercise for 3 months prior. Educate yourself on all the options available and go in with a positive attitude and don't give up. Yeah, it's a weird thing. The giving up thing. I don't know. Like when we're going through it a long time ago. Like the things, pregnancy rates weren't as good, technique wasn't as good, and all that. And I don't know if I could have stomached doing much more. I think there is a point at which people do. They're entitled to get off the treatment wheel. But yeah, if you can keep some persistence and keep focused, through at least a reasonable course of treatment, I think that that's a good thing. Ollie, do you have a suggestion on that too?
Well, I think it's important as a couple or family to have kind of a real, like a goal, and then reassess the goals as you go through things. So,
yeah.
It may be like I've had couples say, we're going to do this 3 times. And if we don't reach what we need to do in 3 times, we're done. Reevaluating kind of as they go, but it gives you mentally gives you a stopping point. Because I think there are some times when it feels like, and Kinley can probably attest to this, where you do another embryo transfer and it doesn't work, and or you have a miscarriage and you feel like the deck is definitely stacked against you. And so that's why I think just psychologically knowing that there's a place where you can stop if you want to like tap out of it. That's very important. I hate seeing patients get on kind of a wheel of they really lose track and lose sight of what the goal was, and they continue on in something that's just really hard and very difficult without an end in sight for them. And I think that's really tough. So.
Yeah, it's interesting. At this last meeting in California, they which they've canceled now, which is a bummer, but there are a lot of practices that now do, like people in their later 30s. They encourage them not to transfer, even if they say, I just want to have one baby. They'll be like, look, we want you to do 3 egg retrievals before you ever do a transfer, because we want you to, we know that what's going to happen is if you get a failed transfer, you're going to be, it may make you depressed or whatever. And so if you create these embryos ahead of time, and then that you're going to be then transferring them later, you're more likely to stick with it. I think that's kind of, it's a little bit weird. It's a little, maybe serves the practices a little bit more than the patients. And certainly for somebody who would just want to have one kid, they might create way more embryos than they ever will want to use. And that can be, I think, psychologically very, very painful as well. But
I think it's really important to evaluate at the end of each cycle with your staff, the doctor, and have that, relook at it. Are we in a good place to go ahead and start transfer? Or do we need to bank more embryos before we do that? And the answer is different for every single person.
Yeah, here.
So, it's important just to keep that dialogue going with your team, because that's why it's a team. And when you come, especially into our office, it is real. I mean, Kinley said it's like a family, but it's more teamwork. I mean, it's everybody has a part in it. And we all, help you tease out what's going to be best for you. I think Dr. Hutchison's really good on the statistical side, or what are the next steps you can that are offered to you. And then sometimes it's just as, nice to have Pamela, who's doing drawing blood, for her to, just chat with you about what some of your feelings are about it. So, that's kind of all of us have a little role in what we're doing. And we're always there to talk with patients about that. So.
Oh, very nice. Cool.
So.
Well, very good. Does anybody, I really thank you for all of your time and your participation. This is really, I think this is going to be helpful for a lot of other patients.
I do. Yeah.
Yeah, really cool.
Thank Caitlin, it was so nice for you guys to mention that, you know, you don't always have to have a complete connection to a child to have it feel really like your own. So
Exactly.
experience that you have, how you build a family is really, it's not always a straight line. Sometimes the little diversions around are what make it exciting, and you end up with, you know, it's just a wonderful way to build a family. Sometimes it's not what you think it was going to be. So
Yeah.
really
Yeah, I remember, you know, when donor egg really started getting rolling back, you know, in the 80s, the psychologists were just chomping at the bit to figure out how people would react to the babies. Majority of the women who were doing those cycles were older and had kind of aged out of having their own biologic children, but almost all of the original patient group that was there in Los Angeles was they remarried these younger guys and they wanted to give them a baby. And so they were like, you know, I've got my own biologic children. So yeah, you know, if we can use his sperm and donor egg, I'll do it. But all the psychologists were like, whoa, is it going to be like, she's like, I don't love that kid very much. You know, not compared to my biologic children. And it turned out that it was no different.
no different.
It's so fascinating to me seeing that. It doesn't really matter. The genetic part of it, I mean, I think is really important for a lot of people. But, you know, in the big picture, you know, you love your kids for who they are and all that stuff.
Yeah, right. This has kind of been really cool that COVID happened, because we would have never done events kind of
right.
Like this. Guys, like I have all these colleagues that I rarely see, because it's only when you go to a meeting that you see them. And I have been on more events shared online and things. So like I'm seeing people that I would only see like once every 4 or 5 years. And some of the leaders in our industry that it's like, whoa, I was just on a call with Carlos Simone. And it's super interesting to see how humans work around the fact that we can't really see each other. And thank God we have this technology. I mean, in some ways, the whole internet and the FaceTime and all that stuff and Facebook can be a negative thing, but when it really comes to human communication, sometimes it's fantastic. And this is fantastic. So I hope that, you know, you guys are all not feeling too, you know, remote from your friends, and that you have the opportunity to share with these funny faces. I think the technology will get better. I'm hoping the next time that my wrinkles will look better and everything, because I'll just have a filter cam on it and I'll look super awesome. I'll look like Sofia Vergara or something, and you'll be like, whoa. Yeah. I really like Holly on the other format as opposed to in person. So,
yeah.
Kind of fun.
Yeah, I've been given my own haircuts and it's not pretty. It's
this is a COVID
yeah.
like yeah, there's a lot of gray. It's not blonde.
Well, I thank you so much. Does anyone have any questions or anything? All right.
No, we don't.
Thank you all so much. And for those of you who are watching, remember, you can always go back and look at archived things, and you can always send us questions, and we will answer them in the next huddle. And if you have any suggestions, or if anybody wants like a topic covered in a huddle in the future, please let us know, and we will try to address that. Because again, I've got more time, and so doing more search, and you know, our hospital librarians are also happy to help, because they're just sitting around most of the time, I think. Yeah, so.
Yeah, it's awesome.
Yeah, give us some.
All right, you guys stay safe and wash your hands.
Yeah, definitely. And wear your masks. My wife went to Costco yesterday, said about 20% of the people weren't wearing masks. And yeah, you can reuse them. We've been putting them out in the sunshine, in the backyard, tying them to yard furniture, and because the virus does not like UV. And yeah, about 3 days probably is more than enough for that. But yeah, stay safe, wash your hands. I've been touching my face here in this thing, but you know, during the daytime, I'm very good about not touching my face at all. So, and when you see us, we're going to be masked up and goggled up and hats on and all that kind of stuff. So
I have fewer wrinkles now.
There you go.
Very good. Well, thank you all. Have a great night.
Cool. Thanks, Scott.
Thank you.
Okay. Hasta luego. We'll see you down the road. Steph and Sterling, Caitlin, Grace, we will see you down the road.
Yes.
Yeah.
Okay.
Bye.
Bye-bye.
See ya.